So I think it serves two purposes. One, it allows us to provide a timeline for what patients should expect after their surgery. Now, in most cases, whether it's physical functioning or mental health or emotional functioning, patients saw a drop in those scores immediately after surgery. But by 6 months, most of those scores were recovered to what they were at before surgery started. And actually, by 12 months, a lot of these fields were improved from their levels before surgery. Now, that's one aspect to say, hey, this is what your timeline would look like after your surgical course. But also, it allows us as providers to understand that this isn't going to just affect patients physically, that we can really measure how it will affect them in their family functioning, their role that they normally inhabit in their daily life, their mental health, their fearfulness and regret as well. So there's a whole component that's very broad about how to treat patients. And I think this data allows us to say the breadth of effects of a surgery on a patient is very wide. We need to consider all of them to make sure that we're maintaining the quality of life for our patients. It's a very good question. It's very challenging. Physicians have limited amount of time that they can see their patients in the post-operative setting. Visits are oftentimes 15 or 30 minutes, and there's a lot of detail that needs to be covered in those cases, but most of that is related to healing and the physical health and also disease progress of that patient. Things like mental health, family functioning, role functioning, those aren't oftentimes addressed both because there isn't a time or also because it's just not thought of, it's not top of mind. This type of data really helps physicians present that and say, I need to address these topics. And if I can't, I need to bring in other providers, mental health professionals, social workers, financial guidance as well, that can really account for the broad effects of surgery on these patients and their disease on these patients. The strength of this, as you mentioned, is that it's very detailed, but not every patient can go through 14 different questionnaires at every clinical visit. It's a lot of time and a lot of investment. What we'd like to do is figure out, well, what questions are going to be most important to those patients at their visits? And I believe this kind of sets a framework for us to say, let's think of a new way to acquire information from these patients that is both broad and multifactorial, but targeted to what's top of mind for them. I would think about this thinking backwards. So clearly our data shows that a recurrence after a radical cystectomy has a significant effect on quality of life, and unfortunately, those patients don't oftentimes recover those quality of life scores back to where they were prior to their recurrence. So there is a durable negative effect from a recurrence. Now, what is encouraging is that the patients that didn't recur or who had yet to recur show that they recovered their baseline function across multiple domains by about 4 to 6 months. So if you're considering a bladder-sparing therapy versus a complete cystectomy, we can present this data and say, actually, your quality of life across multiple domains will recover by 3 to 4 months after the surgery. And the additive insult that a recurrence might cause is very profound and durable. So if in any way a radical cystectomy provides you a more assured way of removing the disease recurrence from your future outlook, then you can consider this and take confidence that actually you will recover from this surgery. And if it improves, the disease recurrence is not something that necessarily you can just get by with in time, that it's going to have durable effects.